is Jackie. I'm going to be your nurse for today. Let me wash my hands real quick. All right. And so what I'll be doing today is I'm going to do an assessment on your baby from head to toe, if that's okay. Okay. All right. And I'm going to provide privacy, and I'm going to verify bands are matching bands. All right, and then patient name and date of birth. Okay, and then if you have any questions, feel free to ask me. All right, let me just move baby a little bit over here like this. Okay, so I'm gonna put on gloves. So this should take about 15 minutes. Definitely stop me if you have any questions, but I will try to explain everything to you as much as I can. But definitely stop me to ask questions, okay? Alrighty. So let's go ahead and start off by getting baby weight. Okay. All right. Oh, perfect. While we're waiting for that, I did go over her birth history, like your birth history with her, and it looked like everything went great and you weren't in labor that long. Is that correct? Okay. Awesome. And then they didn't use anything extra to help you get baby out, right? Okay. All right. Perfect. And then, so did you see the weight? Yeah, it said 3,500 grams, which is good. All right, and then what we're gonna do now, I'm gonna go ahead and do length, okay? See how long baby is. So from top of the head to top of the feet. All right, and it's about the heel. All right, so about 46 centimeters, which is about 18 inches. All right, and then next I'm gonna go ahead and measure here, okay? All right, 35. And I'm gonna go ahead and measure here. And this is gonna be across the nipple line. All right, 32 centimeters. And then while I'm here, I'm gonna go ahead and do the temperature. Okay, 98 degrees Fahrenheit, so that's good for axillary. And then I'm gonna listen to her heart. All right, perfect. So it's 130, which is good. And then respirations, 50, which is good. All right. Okay. And then move her a little bit over here. And then right here have 10 fingers, 10 toes. Awesome. She has a little bit of a cry, which is okay. She's probably wanting mama right now. Okay. So let's start up here. So what I'm gonna do here, I'm just looking at her head, a little bit of molding, which is long, like head, which is fine. Baby's just head was down there a little bit long, and it will change and mold back, okay? Right now it's just the sutures are a little bit, they're open, and what they do is they overlap to get through the birth canal, so that's what makes it look longer. And then let's see, Vernix caseosa everywhere, all over body. Some milia on the nose, which is fine. So Vernix caseosa is the cheesy mustardy covering all over body, normal, okay? Milia is little pimple looking things on the nose, normal, okay? Some lanugo on the back, which is baby hair, that is normal as well. A Mongolian spot here, which I'm gonna document, but that's just a little bit bruising. Like color, it's not a bruise, it's just a spot that when they're born, they have that, okay? It's normal. And then, what else? some caput, which is swellings, generalized swelling after delivery. A newborn assessment is normal as well. And some petechiae, which is like little red, little tiny bumps. And that's normal as well, okay? All right. So let's go ahead and assess the head. Not sunken, not bulging. Anterior fontanelle is the diamond shape here. And then the posterior fontanelle is in the back. It's like a triangle shape. And let's see here. Here's our line to the eyes, and the outer canthus of the eyes. The iris color is a little grayish, which is normal. And let's see, all aligned. Eyes, ears, nose, mouth, all aligned and symmetrical. And then pupils are round and equal bilaterally round and reactive to light. Not accommodating, but that's fine because it's a newborn. It's normal. And nose the nose nostrils are patent bilateral. Alrighty. And there's no dimpling or holes or anything in the ears, which is good. And are well formed and aligned appropriately. Cheeks are good. And then I'm gonna go ahead and touch right here. And that's just the rooting reflex. And baby is turning the mouth towards over here, so that is normal. Put on a glove, different glove, and I'm gonna go ahead and put my finger in here and check for the palate, any holes or openings over here. There's no Epstein pearls, which are calcified deposits in the mouth. And good. And sucked, baby sucked. Did you see that? Okay. And then swallow. Okay, when baby sucked, baby did swallow as well after. Okay. Let's see here. All right. So what I'm doing here, I'm just checking for the clavicles. They're there and they're normal. Okay, just assessing the skin. All right, and then the nipple buds engorgement is normal. Okay. Alrighty, and then range of motion. The muscle tone is good. Skin is appropriate. And then let's see here. So what I'm gonna do now is the chest is symmetrical and aligned and not concave. And just so you know, I did hear a little bit of a murmur when I did check the apical pulse, but that is normal and goes away, okay? So we'll just be assessing it though, okay? And then let's see here. So I already said 10 fingers, 10 toes. I got the weight, length, heart rate, got the respirations. All right, perfect. And then I'm gonna go ahead and baby's poop right now is gonna be looking a little like dark, tarry, with sticky poop. That's normal in the beginning, okay? That's called meconium. Okay, I'm just gonna listen to bowel sounds. You said you did feed her a little bit and she tried? Okay, let's see. Just listening to bowel sounds. Oh yeah, it's a little bit, yeah. So she might poop a little bit after this. Alrighty, okay, so let's see. Okay, so let's go ahead and just check genitalia. All right, labia majora is covering everything, and it is a little bit looks like a little swollen. That's normal, okay? And there's no discharge, so that is normal as well. But if there was like a little bit of red, like a bleeding scant discharge, that is normal because of hormonal changes, but she didn't have that, so we're good. I'm just checking the spine. Okay, no holes, no openings. All right, and anus is patent. Alrighty. All right, and then the alignment is good, the curvature. Yeah. And then let's go over here. So the legs, let's check for hip dislocation. Nothing. Nothing. Okay, good. No clicks, so we're good there. All right. So I'm going to start with the reflexes. This is going to be a starter one. Oh, good job. Good job. Pass your test. That's the moral reflex. All right. And then we're going to do the tonic. So if I go ahead, switch here. Oh, good job. Alrighty. Okay. And then we're going to do, let's see, rooting I already did. Sucking I already did. Let's do stepping. Good job. All right. So active and alert. Look at you. Okay. And then we're going to go ahead and do the one for the back. So it's called the gallant one. And what I'm doing here is I'm just touching the side of her spinal column. And then she's curving that way. Okay, good job. Alrighty. And then what we're gonna do is the Babinski. Flare toes, good job. Flare toes, all right. And then Palmer, perfect, she's grabbing me. And then plantar, good job. Grabbing me everywhere, all right. Did a good job. You're passing your first couple of tests. And then let's see here. So we have all of that. I did go over the bowels. Right now it's going to be meconium, sticky, tarry. We do want to watch for avoiding patterns, okay? She is active and alert right now with her little coos and a little bit of crying here and there. Active alert, so she's active by being alert and making some noises here and there, but she's not full on crying, so we're good to go here. And then let's see, I think we are done. So if you have any questions that you can think of, please let me know and I will get to you. Okay, alrighty, thank you so much.